Hello all and welcome to the Fraud, Waste, and Abuse training for 2023. CMS requires that we do this training yearly, so this seemed like a good way to accomplish that. Unlike the HIPAA training, fraud, waste, and abuse may be a little less familiar, so hopefully you learned some little tidbits, and let's get started. The objectives of this course are to define fraud, waste, and abuse, recognize the OIG's role in fighting fraud, waste, and abuse, identify prevention, reporting, and self-disclosing measures for fraud, waste, and abuse, understand what conduct violates federal fraud and abuse laws applicable to healthcare providers, explain the potential consequences for healthcare providers who engage in violations, and identify the risk areas that could lead to violation of these federal laws. So what is fraud? Fraud is an intentional or deliberate act to deprive another of property or money by deception or other unfair means. In the healthcare setting, fraud is intentionally submitting false information to the government to get money or benefit. Some examples of healthcare fraud are submitting false claims, such as claims for services that were not provided, inflating costs reported on cost reports, diverting prescription drugs, offering or receiving kickbacks for patient referrals, and providing medically unnecessary care. What is waste? Waste includes practices that directly or indirectly result in unnecessary costs to federally funded programs, such as overusing services. Waste is generally not considered to be caused by criminally negligent actions, but rather by misuse of resources. An example of waste in our clinic is if we decided to draw lab work on every single patient that came through the door, or if we decided to do like preventative x-ray screenings that weren't necessary. While we're able to do those things, they're not really necessary in care, so that would be considered waste. And the last term to define is what is abuse. Abuse includes actions that may directly or indirectly result in unnecessary costs to federally funded programs. Abuse involves paying for items or services when there is no legal entitlement to that payment. An example of abuse in the system would be upcoding. And so if we saw a patient just for a nurse visit and we charged for like a level 3 or a 4, that would definitely be abuse. Or if the person came in just for a cough or a cold and we charged them a level 5, that's abuse of the system. And so we want to make sure that we are coding accurately. When we think about how fraud could occur, there are 3 areas on the fraud triangle that makes an environment for fraud to occur. Those areas are pressure, opportunity, and rationalism. On the pressure side, this is like what's going on in someone's life that drives them to commit fraud. Pressure sometimes involves personal, internal, or community, which would be external situations that create a demand for things such as more money, increased opportunity status, or employment promotions. Here are some examples. An example of external pressure would be if, for example, Aledade were trying to meet specific metrics, and so we feel that pressure to do a good job, and so we start billing, AWVs that we didn't do, or we start billing diagnosis codes that we didn't address. That would be an example of external pressure. Internal pressure is like if you know that we need to meet a specific metric as far as money goes per visit, and so we end up upcoding to try to meet a certain revenue goal. That would be an example of external pressure. The next side of the fraud triangle is opportunity. Opportunity, as it relates to fraud, is the chance to take advantage of a situation. Opportunity involves both the knowledge and the ability to commit fraud. Here's an example. Dr. Johnson, who owns the local foot and ankle clinic, had 2 friends that were also patients. Dr. Johnson talked with her friends and presented them with an opportunity. She told them that she could write them false pain medication prescriptions in exchange for keeping a portion of the pills for herself. Meanwhile, her friends could pay for the medicine with their Medicaid benefits and do with the pills what they wanted, even sell them. The result was that both Dr. Johnson and her friends defrauded the government to gain uncontrolled pain medication that was not medically necessary. The last section on the fraud triangle is rationalization. This is the attempt to explain or justify behavior or an attitude with logical reasons, even if the reasons are not appropriate. There are two aspects to rationalization. The individual must decide that the perceived gain from a fraudulent activity outweighs the risk of being caught, and the individual needs to justify the fraud. Some examples of justification include the attitude that everyone is doing it, job satisfaction, perceived entitlement, helping one's family financially, or preserving one's status. There are different levels of fraud. Not all fraud is created equal. For example, a mistake such as incorrect coding is not as bad as intentional deception, such as billing for services or supplies that were not provided. And so when we think about penalties for fraud, waste, and abuse, there's different levels and different repercussions for each level. It takes a whole team to keep an eye out for fraud and make sure that fraudulent activity is not occurring. A way to keep eyes on it is to look out for these red flags. One red flag would be issues with documentation, such as abnormal billing patterns, indicating overutilization of services, listing incorrect procedures and medical charts, usually listing a more expensive procedure than one that was actually performed, listing incorrect or unnecessary expensive medications. Another red flag would be changes in attitudes or performance, such as unreasonable explanations and attitudes, including annoyance at questions, deviation from standard procedures, decrease in quality of work, preventing full transparency on issues, including money, such as review and approval of expenses. And the last red flag would be financial red flags, such as unexplained spending beyond one's income, use of several different banks or bank accounts, or frequent bank changes, and shifting costs from one account to another. Like I said, it takes us all keeping our eyes out, from the receptionist to the nursing staff to providers and billers. We all have to keep our eye out and make sure everyone is acting with integrity. The next section of this presentation goes into specific laws and acts that relate to fraud, waste, and abuse. The False Claims Act allows the federal government to recover damages and penalties from entities that knowingly submit or knowingly cause to be submitted false or fraudulent claims to the federal government, including to Medicare or Medicaid. Knowingly in this case is not only actual knowledge, but also instances in which the person acted in deliberate ignorance or reckless disregard of the truth or falsity of information. The FCA prohibits filing a claim for an item or service that was not actually provided as claimed. Every time we submit a claim, we are essentially certifying that all the criteria for payment for that item or service on the claim has been met. An example question for this is, a mental health clinic provides a group therapy session to 15 children once a week. However, the clinic psychologist who conducts the sessions documents the services as if he provided one-on-one therapy sessions to 15 children once a week. Consequently, the clinic bills for 15 one-on-one sessions rather than one group session. Could the psychologist be liable under the FCA? The answer is yes. The psychologist knowingly documented his services to falsely indicate that he provided one-on-one services rather than what he actually provided, which was group therapy. The next question is this: could anyone else at the mental health clinic be liable? The answer is yes. The clinic could be liable if it knew that the psychologist was falsifying the documentation or acted in deliberate ignorance or reckless disregard of the truth by submitting the claims. Any clinic employee could also be liable if they knowingly participated in the submission of false claims. The federal anti-kickback statute is a criminal law that prohibits the knowing and willful exchange, offer to exchange, solicitation, or receipt of anything of value in an effort to influence, induce or reward the referral of federal healthcare program business, and arranging for or recommending such items or services. The anti-kickback statute may also be referred to as the Stark Law, which specifies regulations on physician referrals. The Stark Law prohibits physicians from referring patients to entities with which they have financial connections. This includes inpatient and outpatient hospital services, home health, lab services, physical therapy, speech therapy, anything like that. Here are some examples of improper kickback relationships. A diagnostic lab offers the nurse practitioner $100 for each Medicare referral. An oncologist takes family vacations paid for by a pharmaceutical company in exchange for prescribing the company's drug in lieu of alternatives. The last one is a medical equipment company and a physician agree that the physician can establish a rent-free office in a space owned by the medical equipment company if the physician refers Medicaid patients to the company. So no beach vacations from any of our nice pharmaceutical reps. The Office of Inspector General has the authority over these fraud, waste, and abuse cases. The graphic on the left shows you some of the departments that follow under the OIG. The OIG's mission is to detect and root out fraud in federal healthcare programs, including Medicare and Medicaid. The OIG takes steps to fight fraud, waste, and abuse in health and human service programs by preventing, detecting, and deterring fraud, waste, and abuse, fostering sound financial stewardships and reduction of improper payments, and holding wrongdoers accountable and recovering misspent public funds. One thing I thought was interesting in doing research on this is that for every $1 paid into the Office of Inspector General, they recover $4 worth of fraud and abuse. The OIG has exclusion authority. This means that they can exclude healthcare providers from federal healthcare programs if the provider has committed certain acts such as fraud or patient abuse. For example, no payment may be made to a hospital for the items or services furnished by an excluded nurse to the federal healthcare program beneficiaries, even if the nurse's services are not separately billed and are paid for as part of the Medicare diagnosis-related group payment received by the hospital. Also, the excluded nurse would be in violation of her exclusion for causing a claim to be submitted by the hospital for items or services the nurse furnished while excluded. So what are the effects of exclusion? No payment shall be made by Medicare, Medicaid, or any other federal healthcare program for services furnished, ordered, or prescribed by a person or entity who is excluded. So if we ended up being excluded by effect of fraud, we would be cut off from all Medicare and Medicaid payments, which we frankly could not afford to do. So this is a huge penalty. Other penalties for fraud, waste, and abuse would include fines, significant fines, and or jail time. So if you suspect that fraud is happening, there are ways to report it. You can report it online at this link. You can call in by phone, or you could fax in the information. You're able to report it either anonymously or you can attach your name to the report. Another way to report fraud would be by self-disclosure. The OIG has established a healthcare fraud self-disclosure protocol through which your organization can self-disclose violations if it discovers it has violated the laws we have covered today. For example, a provider may disclose false billing or employment of an excluded individual. The OIG believes that good faith disclosure of potential fraud and cooperation with OIG's resolution process are indications of a robust and effective compliance program. Those who use the self-disclosure protocol may receive a lower penalty. Most of the information I presented today was from a course put on by the OIG and the HHS. If you're interested in more information, I'd be happy to send that link to you. Another great course is through the Allied Learning Center. It's Medicare has put on a course about fraud, waste, and abuse. That was very robust too. So if you're interested in more information, I can help you pull that up. Thank you for attending today. I appreciate your diligence in this. Let me know if you have any questions or concerns. Would be happy to go over those with you. Have a great rest of your day.